Good evening. First tonight, the removal of Plan B restrictions and claims thousands of people will be left feeling like prisoners in their own homes. The Buckinghamshire Disability Service wants to see a long-term solution to living with COVID-19. It comes as cases in Oxfordshire have gone up in the past week, with rates in some schools among the highest in the South East. Sarah Loudon reports.
From tomorrow, it'll no longer be compulsory to have one of these to go into somewhere like a shop, although the government is advising people to wear one in crowded public spaces. For many, it'll feel like another step towards normality, but that's not the case for everyone. This is how carefully Freya from Wendover socialises with her friends. She has a condition which affects her immune system and thinks Plan B measures should be kept.
Ideally, masks and social distancing is just a short-term solution that we need to do for another couple months, another year, to knock it on the head. And then everyone can go back to normal as a country together, instead of segregating different parts of the population away because they're not able to do it safely. I think I just ask people to be really open and aware of the fact that there are going to be people in the community, quite a lot of them, who are incredibly uncomfortable and feel unsafe with these changes, and to consider still wearing a mask, still social distancing.
A Buckinghamshire charity says the long-term solution that will allow everyone to get back to normal is to introduce tighter regulations for ventilation.
If the government had started making it compulsory through regulations for places like supermarkets and schools and public buildings and nightclubs and pubs to filter their air, the problem would be far gone away. That's a permanent solution, not a short-term one. And it's perfectly technically feasible and it's affordable as well.
The lifting of restrictions comes as COVID cases are bouncing back sharply in Oxfordshire. The county has some of the highest case numbers in the South East among 5 to 14-year-olds. People here are being urged to remain cautious.
We do have a small proportion still get severely ill with COVID, so we need to be mindful of that. If you have very high levels of COVID, we'll have high numbers of people having to self-isolate, and that means our workforce, particularly in the health and care sector, will be significantly reduced. And we saw the impact of that during Christmas time.
The Department for Health and Social Care says it continues to monitor the risks so it can protect the most vulnerable. It advises those people to consider taking extra precautions to reduce their chances of catching the virus. Anne says that vaccines are the best way we can protect ourselves. So from midnight tonight, it's Plan A. The weeks ahead will show whether we can live with the virus without restrictions. Sarah Loudon, BBC South Today.